Hello and welcome to episode 102 of Tom's Hirschsprung's podcast. I am delighted to be joined this evening by Lillie. Lillie, welcome to the podcast.
Thank you. Hello.
Thanks so much for coming on. We are here to talk about another Hirschsprung's story. And lots has happened in this story. But this is a real sort of feel-good one as well, I believe.
Yeah.
Well, obviously you will tell a lot more later on.
Yes.
Um, but I guess we'll kind of start, well, wherever you want to, really. We can start from the beginning if you want.
So I we went to the hospital January 31st because that was originally my due date and I was feeling a lot of pain, so they went ahead and induced me and the labor went beautifully. I had him at 1:54 in the morning. By 3:30 that afternoon, I went to put him down to swaddle him and he choked and turned blue. NICU nurses came rushing in and they took him to the NICU to do some tests and kind of feed him because he was not taking any bottles or any fluids, like he wasn't accepting nothing. So when they took an ultrasound, they realized that he had a blockage in his abdomen that was right near his colon. So they kind of watched it and kind of took ultrasounds every day and was like, okay, it's like a small regional hospital that I gave birth at. So they went ahead after the fourth day to transfer him to a major children's hospital where they have more machines and more equipment to do more work. So about the fifth day of us getting to the hospital and getting comfortable, um, they decided to take a piece of his colon out, kind of do a little procedure to where they took a good piece of it and kind of watched it grow over the next couple of days to see if there was no nerves in his colon. So I want to say maybe after a good 3, 4 days of it growing, they came back and told us that it had not grown nerves and that he does have a condition called Hirschsprung's disease. Me and my wife were kind of looking at each other like, oh no, like, what was that? We're very unfamiliar with it. I've never heard of it. And he's like, okay, this is what's going to happen. So he kind of sat us down and he explained to us. And the major thing he explained to us is Hirschsprung's enterocolitis,
Right.
which is fevers, disgusting poop, hard tummy, things like that, and it could be very fatal within 24 hours if not treated. So he kind of explained, kind of watched Oakley, my son, a little bit, and maybe a week after they decided, okay, let's feed him, and he did amazing with feeding, and um, he said we're going to start something called irrigation, to where so we put trying to think of the words to say it without um we put they gave us a hose to flush fluid and push fluid up his rectum to kind of try to pull everything out, and he did beautifully with that. So after a good 15 days of being in the NICU, they decided that he was doing amazing and they've never seen a baby with this kind of condition that was doing so well. So they sent us home for about 3.5 weeks until they were planning to do a major surgery called a pull through. They gave us the date through surgery. We arrived at the children's hospital. We went back into the room to wait. They did their test. The surgeon had came in. He has an amazing surgeon team. Like I wouldn't trade his surgeon in for the world. Um, So they came in, they were like, okay, we're going to take him back. It was a 4.5 hour surgery. They when the surgeon came back out to tell me after surgery, he told me that he had put four small incisions into his belly with a camera to kind of look around and see where that dead piece of colon was. He went up through his rectum with a laser and decided to cut a good chunk of his colon, and he pulled it to his rectum, and they watched him for a couple of days until he went to the bathroom. And once he started going to the bathroom, they decided to send us home. And now we see him every 3 months to get checkups for it.
Right. I mean,
Yes.
that's a heck of a first few, well,
Yes.
yeah, a couple of weeks, give or take, the 15
Yes.
days you said in the NICU, which
Mhm.
is, yeah, a long time to spend there. Um,
Right.
and then when the so the when the so when they did the biopsy,
Yes.
when because sometimes some doctors and surgeons are different in the way they explain how much of the colon's affected. So did they say whether it was short segment, long segment, or
Yes. It was after they watched it for a couple days and realized they had told us that it was a short segment.
short segment?
Yes. It
Which I
was a
think,
very, by the grace of God, it was a very tiny piece.
yeah, yeah,
Yes.
no, I think from the research I've done and from people I've spoken to, short segment is the most common.
Yes.
With it being, I think it's about 80%, give or take.
Right.
Um,
With the long segment, they do require them removing the colon and putting a colostomy bag in, which was an option if the pull-through surgery did not go amazingly and successful.
yeah, I guess that's
Yeah.
the thing as well with they can do the biopsy, but until they've actually been in there,
Right.
they don't always know exactly how much they're going to take out, I
Right.
don't think.
Right.
Some surgeries say that they give you it in measurements. Some just say short, long, ultra short,
Right. Right. Right.
polycolonic, whatever it may be. But no, that
Right.
definitely sounds. And a lot of people come to me and they say, "Oh, well, Hirschsprung's is genetic, or it's this, that, the other." I'm presuming this is not a condition you'd ever heard of before.
Right.
So no sort of history or anything within nothing.
Yes. My side of the family does not have it. My wife's side of the family does not have it. We went through an IVF clinic to have a baby, and that person that we went through, they didn't have it. The person. So it and his medical team did say it is a very common disease, and most people don't know about it until they go home and years later.
Really?
Yes. He said some
What's
Um, so a lot of people when babies are born and you think, oh, your baby can't go to the bathroom, oh, it's normal because they were in the belly for so long, or oh, it's the milk, or you tend to think of so many things, and then when you finally go and be like, hi, my baby is really crying and really upset, then they do test, and a lot of people are amazed when they hear that word. I had to explain to my whole family about it.
Oh, I can imagine you did.
Yes.
Yeah, it's one of those conditions where it's not a 2 minute explanation either.
Right.
I imagine it's like, right, okay, this is this, and then this happens, and I
Right.
imagine it was a little bit of a more of a sit down conversation. Is that right?
Right, right. A long sit down conversation, and okay, this is what happened. I had to draw them a picture of what the surgeon drawed me and showed them. And yes,
Wow. So yeah, it is. Yeah, it's a complicated illness, but that's
yes,
interesting that they believe that it's more common than, I mean, the generic terms, obviously
right,
1 in 5,000,
right,
which
right,
I think makes us rare, but not like ultra rare. I don't know what the
right, right,
correct term is.
right,
Um,
correct.
but from some of the surgeons I've spoken to, they have of the same opinion, where they think actually it's more than it's more than that. It's probably more
Right,
like 1 in 3,500 or 4,000 or whatever it might be. And
right,
that might be the reason, as you said. I know I'm just sort of surmising here, but that might be the reason you said some people might actually not know that they've had it, or
right,
do I say have it or have it, until they go home, and they may think, oh, actually, I've struggled with stomach issues,
right,
and might not even, because like you said, you went to a smaller hospital and then a larger regional hospital.
right,
A lot of the smaller hospitals, I can't imagine have heard of Hirschsprung's a great deal.
right, right. Or they don't have the equipment to be able to, do small procedures like that because the hospital we went to was very small, very, very small. Their NICU was very small. And when they transferred us to the children's hospital, as soon as I was there, they were able to explain to me what was going on and what they were going to do and what tests. Then waiting 4 days for answers. I got answers right away, and they started doing stuff the next day he arrived.
Yeah. Yeah, and obviously that's far helpful for both of you as well.
Right,
Far more helpful than sort of coming back, waiting, and then like the biopsy, for example. Doing the biopsy, you can have that sort of that can then come back pretty quickly rather than
right,
going away for I think you said like 4 days or something.
right, and not know nothing.
No, no.
Yes,
So you said you were in the NICU for about 15 days or so.
15 days.
How did you, I guess, pass the time in that 15 day period? Because I know that can be, having spoken to a lot of mothers, it's that sort of you can't necessarily do anything. You can't leave. You can't, do the operation yourself. How
Right.
did you kind of negotiate that?
So the main thing that I did was take a lot of walks. Outside of the hospital is a beautiful walk around, as well as a mini golf like thing that you can play mini golf in, and there's a basketball hoop. So there was a lot of things to do outdoors, and we went to a lot of like activities they had in the hospital, coloring, make you a basket. I went and made a lot of things for my son, to help pass the time, and we ended up staying in his room with him the whole 15 days. They let the parents stay, so yeah, we did not leave. One day, I my heart hurt when we went to the gas station for 2 minutes.
Yeah, I
So
mean, you just, but that makes absolute sense. So you don't want to, obviously, you don't want to leave at any point, do you? Because for whatever reason. But yeah, no,
right,
it's good that you were able to stay in his room with him as well.
yes,
That's excellent to know because then
yes, yes,
you can be with him at all times, which is
right.
fantastic.
And they also did include me every morning in rounds. They asked me if me and my wife would like to stand out there and listen to all the doctors talk. So we did that majority of the days, but some days I just sat back because I'm a worry wart. So I ask 1,001 questions, and sometimes I felt like I didn't let them talk or get what they had to say before I jumped in and was like this or this or this, and they were like, "Calm down, let us finish." So
But that's the thing, especially with it being a condition that you've never heard of before, and
right,
that a lot of families go through this similar situation where they haven't heard of Hirschsprung's, never mind
right,
note what part of the body it might affect. You
right.
are going to have a million questions, aren't you?
Yes. And I feel like the you get answers, and then there's more questions, and then there's more questions, to where my surgeon, my son's surgeon, sat us down for a good hour and a half, 2 hours, kind of like, okay, let me dumb it down for you. Okay, this is what's going on. This is what is gonna happen. This is everything. Here's a paper. I highlighted some stuff too. Like, he was very understanding with us, and helped us a lot.
That's really good to hear. That is really good because you
Yes.
can. So when people start going into medical terminology, and
Right.
sometimes for doctors and nurses, it's everyday language for them.
Right.
They're talking about ganglion cells, they're talking about
Yes.
this and
Yes.
that and the other. And sometimes they can talk to you about all of this stuff, knowing what
Right.
they mean, but the
Right. But
fact that
us
they
not
went down,
knowing.
yeah,
Right.
yeah, because like you said,
Right.
it's completely new to you, and
Right.
it almost, yeah, I don't want to use the phrase dumbed down because I think that's,
Right.
but it needs to be, yeah, simplified a
Right.
little bit just because it's so new, and these are completely new terms that we're
Right.
having to get used to.
Yes.
Um, but it's, yeah, but it's good to know that they went through that with you and were really good and supportive and all of
Yes.
that, which is fantastic. And this was the larger hospital.
Yes. It's a A1 rated hospital.
I presume that's a good thing. I don't
Yes,
know my
yes.
ratings, but
Yes, it's an amazing hospital. They treat every kind of patients. Yes.
fantastic. No, that sounds, well, A1 sounds fantastic. So I
Yes.
presumed it was a good one.
Yes, the NICU nurses in the hospital I gave birth at made a joke saying, "Don't lose in contact with us after you go to that children's hospital and see how beautiful it is." And I make sure to this day that I still give updates to his NICU nurses at the hospital he was born at and kind of, walk them through. And yes,
Fantastic. And if I take you right back to the beginning, you said, see, giving birth in January, and we are talking about this January just gone, January 2025. So
yes,
only Oakley is only about 8 months or so
yes. He
or
just
so
turned eight
old.
months on the first. Yes,
Fantastic. So yeah,
yes,
so he's one of my youngest people to be on the
yes,
podcast.
yes. Oh,
But
that's
that's
awesome.
fantastic. So no,
Right.
thank you so much for doing this as well, because I know
You're so welcome. Right.
eight months after giving
Yes.
birth is
I have to be very honest. Watching your other podcasts and watching your videos have gave me a lot of strength and a lot of courage to be able to post more and tell his story. And I wanted to share his story that way any other moms or any other family or anybody that just feels alone with any, health condition that their child has. I'm here to lend a hand, to lend an ear, to lend a shoulder, just help the community.
that's brilliant, because I think there is way before I got there a really good Hirschsprung's community online.
Right.
And I know I mean, so interviewed most of them. Um,
Yeah.
but it's, I think that kind of support is, like you said, is so important. I know probably my parents 30 years ago would have benefited from having some kind of, whether it be the forums, whether it be the Facebook things, whether it be
Right.
TikTok, whether it's, Instagram, whatever it might be. Um, what else? I guess from those sort of TikToks and um, not Instagram, the TikToks. What else have you found, or who else have you found really sort of beneficial? Do you think?
I found another mom on there who I do watch. Her son, I want to say, is maybe 6 or 7, and they are quite in the hospital a lot. Unfortunately, he does have a lot more problems and a lot more issues. But I always tell her, I'm praying for him, and I tell him. So sometimes I don't want to, not necessarily brag, but to tell everybody how much of a success my son has when I hear other people's stories.
Yeah.
It's like a kick in the face, and I personally don't like that. So I'm like, oh, my son has Hirschsprungs too, and if they go to my page and watch the video, then they watch it. But I'm not the type of person to be like, oh, well, my son is, good. I love hearing all stories. I love children. If I could have them, I would have a ton of them,
Yeah.
you know, and so I'm just now starting to get into more watching more videos. I try to kind of check out who you have on your podcast. That way I can, try to learn a little bit more. Um, but yeah, I'm excited to see how many more others I can meet.
Yeah. I mean, there's so many. I mean, so many people.
Right,
I mean, and those are just the people I know, and I know that I'm missing loads and loads and loads of people. So
right,
yeah, there is a. I think for people who think, oh, well, it's such a rare condition, I won't find many people, or I've got a child with long segment, or whatever it may be.
right,
You might think, oh, well, actually, I won't find that many people. There are a lot more, I think,
right,
than than maybe people first realize. But I
right,
take your point as well when you mention, because Oakley's doing so well,
right,
it's it's almost harder in a way,
right,
because you then feel, actually, I do I want to share the success when people are going so well? But I think I'd look at it, yes, slightly the other way and go, actually, the more success stories we share,
right,
possibly the more, I know everybody's different, and we're never going to say this is how this is going to happen, or whatever.
right,
But the more success stories we share, the better. I think that does give a lot of hope to people because I think
Yes.
sometimes when I read a lot of stories now, people who message me and whatnot, and I do hear lots of things that maybe don't go so well, or maybe
Right.
people are struggling with this, that, and the other. Sometimes to hear that things are going really well,
Right.
I think is a positive.
Yes. Very much. It's
But
it's amazing to hear anybody's story and to hear, you know, anybody, I love hearing any kind of stories. I'm on the whole medical side of TikTok, so I hear all the stories about all these, health conditions, and it melts my heart.
yeah, yeah, it's. But I think it's one of those where because I mean, there's so many different varieties of Hirschsprungs, and then
Right.
all of those varieties come with their own potential other conditions as well that are associated with
Right.
Hirschsprungs, and everybody's completely different. That sometimes
Right.
just hearing actually things are going quite well
Yes.
is really nice. And I know I've been getting messages from people who want these kind of episodes that we're doing today, where
Right.
there's not it's not so much drama involved
Right.
potentially, and it is very much a case of yeah, this happened at the beginning, but actually, you know, eight
It
months
turned
in,
around.
yeah, and
Right.
things are going well. So just sort of on that point, I guess, how is Oakley now?
So Oakley is doing amazing. His surgeries have healed completely, or I mean, I'm sorry, his incisions have healed completely. Um, we do not have to do no more irrigations nor dilations. So he is kind to, his surgeon said just let him go, even if he goes to the bathroom one time, two times, three times, it's good. Long as it's moving. His stomach is always very soft. Okay, come, I know, come
Do you want
on.
to come and say hello? Come on in. For audio listeners, Oakley's just joined us.
So he is doing amazing. The only thing that was a big trouble for us after is that he had skin tags from the surgery. So it took a while for them to go away. We're still using the special cream that we used when he did have surgery. So those are just little minor things that we still have to do. But he's doing amazing.
Brilliant. That's so,
Yes,
so good to hear.
yes,
Because like you said, with surgeries and whatnot, obviously there's
right.
all manner of things to think about and what have you, but great to hear that he's doing so, so well.
Yes,
Um, and I think you mentioned that the pull through was around 2 months old, was that right?
yes. It was March 27th, so he was almost 3 months old.
Almost 3 months.
No, oh
Okay.
no, I'm sorry, almost 2 months. Yes,
Yeah,
almost two.
January to March. Yeah.
Yes,
Yeah.
yes.
Sorry, my bad. It's late
No,
here.
you're okay. I wasn't even thinking. Time has gone by so fast. These months have flew, and I I told my wife the other day, I'm like, okay, hold on. I gotta tell you his story again and make sure I remember everything that happened and make sure I'm saying everything right. And there's a couple times where she was like, hold on, this is what it's called. And I'm like, this is why I needed you. Thank you.
Yeah, yeah, because I imagine again when you're, I guess, kind of go back to the NICU as well. When you're in the thick of it
Right.
and you're talking to doctors and you're spending lots of time in the NICU, I guess all of it. Well, certainly when I've spoken to other people, all of it kind of melds into one great
Right.
big blur. Was it similar for you?
It was definitely a lot. It was a rush of emotions, rush of feelings. It was very confusing, like, oh my goodness, is this something that I could have prevented, being pregnant? Is there anything I could have done? And every surgeon has says no, ma'am. She said no matter how many tests you could have taken, um we would have never been able to tell you that he had this health condition from being in the womb.
No, no, and I get that again from plenty of parents who say, "Oh, could I have done this? Did I eat the wrong thing? Did I?" No, basically, basically from like you said,
Right,
with every surgeon you've spoken to, certainly every surgeon I've spoken to, it is just pot luck.
right,
That's it, and that's so difficult sometimes to rationalize
right.
because I guess as humans we want to rationalize things,
Yes. Yes.
and we kind of want to say, well, this happened because this happened.
Right.
And it's really, really difficult to sometimes just go, nah, nothing we can do.
Right. And that was another thing that kind of accept upsetted me, is that there was nothing that me or my wife could do for him while he was in the hospital or why they were running this test, they with the feeding tube down his throat and all these surgeons coming in and out, and tests getting done on him, and him being only a couple days old, was a lot for both of us.
Yeah, I can imagine that was, yes, a heck of a lot, especially as 15 days prior or a few days or weeks prior, you'd never heard of
Right,
this condition, and then suddenly you have to
right,
become almost experts in it, I guess.
right, right, 100%, yes.
So, and that's the one thing well, there's several things, but one thing in particular that I do really admire about parents of children with Hirschsprungs is the amount that you have to take on in such a short space of time. I mean, you have no time to think, no time
Right,
to kind of process anything. It's right.
right,
These things that I never knew existed before, like dilations and washouts and
right,
ganglion cells and short
right, right,
segment and
right,
biopsy and all of these terms and all of these things that you didn't know existed a few weeks ago. Suddenly you have to
right.
become an expert in it.
Right, when they ended up taking a piece of his colon out to watch it, they like I said, they used medical terms, and then after they did it, they kind of sat us down and was like, okay, this is what we did,
Yeah.
you know. Yes.
Wow. That is, yeah. And then you have to,
Be
yeah. And
like,
then I guess you
okay,
have to.
right, you have to be like, okay, well, any answers? And then they're like, no, it's going to be a couple days. And then every day you're like, okay, anything, anything, anything. And then they're like, no, we'll come in. And your anxiety and your heart, and you just get that nauseous feeling in your stomach, like, oh my goodness, could it be, short? Could it be long? Like,
Did
no
you?
answers, but just
No,
waiting.
no, exactly. And that's not like a doctor fault. It's just one of those things you just have to.
Right,
It's just a waiting game, unfortunately,
right,
sometimes, especially with things like biopsies.
right.
Um, and in that time, did you sort of Google stuff and try and find out more? Because I know some people are like, no, I don't want to Google anything, and some people are like, we want to know everything.
Yes. I did a lot of research myself. I had a notebook that I kind of jotted everything down. I looked at a lot of images. Um, And I'm not gonna lie, Googling it was very scary. It was the things that sometimes it tells you, or the pictures that it shows you, it is very fearful. So, like my surgeon, he always tells me, listen, you can't listen to everything that has Google. Read it, jot it down. Any questions you do have, you come to me, you ask me, and I will tell you true or false. So that's what I did. And every couple visits he had after his surgery, I would say it was every either month or 2 months that we had to go back and see him to do monthly checkups on him. And I would write down all my questions or all the things I read, and I would take it to him and I would show him, and I'll be like, hey, this is, my question. This is my question. Is this true? And you don't know how many times he told me no. Just log off of Google.
Yeah,
Just log off.
yeah,
He's like, let me
definitely.
send you home a packet, and you read through that packet and you highlight everything and do your little notes and all that on the packet. And that's all the true information that you need.
Yeah,
So
definitely.
to this day, he still explains the Hirschsprung's enterocolitis to us. They were very on top of us about that, because we are young, and um, they, didn't want us to not know what to do or get stuck in that situation. And that, they were like, here's my number, here's my card, like I'm gonna make sure I call you. And I would say maybe 3 months, 4 months of him being home after surgery, they did give us a call and asked how he was doing. And then here recently, they sent a card with like 7, 8 nurses that signed for him of the NICU team, and heard that he was doing amazing and that he will be going to the hospital tomorrow for a circumcision surgery. So they're all can't wait to see him, and it's just the love is so, so unconditional and so real, and it helps you a lot.
Yeah, I can imagine that that really helps that I
Yes,
mean that they took the time to do that because obviously we all know that nurses and doctors really care about the patients
right.
and whatnot. But the fact they took time to call and send a
Yes,
card and that's really, really good to hear. Really good
yes.
to hear.
The one thing I can definitely say is build you a support team. Build you a support system. Have a support system. Don't, want to keep everything bottled in and not explain to nobody how you feel about this. A support system is a number one key, for parents that have children with this health condition.
Yeah. Yeah,
Yes.
I think again, having spoken to several parents as well, they do believe that's really, really important. And I
Yes.
know it's kind of sort of say sort of easy to think about actually a support system would be good. I think we all know that it would, but it's sometimes not as easy to open up. I guess
Right.
some and everybody's different. Some people really, really struggle. I know you said at the beginning you found it very difficult to write his
Yes.
Oakley's story down, and that makes absolute sense because
Right.
it is, and I don't use this word lightly, and I know it's often overused, but a traumatic time. It is a
Right.
traumatic time. Um,
Yes.
Understandably, you're going through all manner of things that you didn't know existed beforehand, and now you have to know all of these things, and it's an incredibly, it's a bit of a whirlwind, I guess.
Yes. Yes. It can
And
work you up and many emotions, and already having a baby and dealing with postpartum depression and really going through it, it's really good to be able to open up, whether it is a partner, whether it is a nurse in the NICU. The nurses, I was talking to my other friend, she's a mom as well, and I told her, I said, you cannot find one nurse to just let all your anger out on, because you're just have so many built up emotions, and they're so sweet and so loving for your child, and come running if they hear a peep from them, that you can't find no one to get mad at, and you can't, explode on anyone. And I think that's why walking helped a lot too. I could go outside and I could scream, or I could tap my foot, 100 times, or I can just look on my phone and cry. So it was a lot of advantages to that.
yeah, most
Yeah.
definitely. I think walks are underrated,
Yes.
massively underrated.
Yes.
But it sometimes, and again, everybody's different, but I think having that mechanism of release
Yeah.
is because there are going to be a lot of emotions, whether it's relief, whether it's anger, whether it's
Right.
and everything in between. I mean, from I guess from my own experience as well, you kind of think, well, why me?
Right.
Why am I the one in 5,000? Why
Right.
not the other 4,999?
Right. Right.
Um,
Right.
so there's that emotion, there's that to think about, and but then there's the sort of relief of going, well, actually, I'm all right, I'm okay. But
Right.
and I imagine you went through those as a parent, definitely,
Right. Yes.
and
Yes.
and
It I think the main thing that kind of broke me in the beginning, when I did find out about this disease, that there was no cure, that he was going to have it for, the rest of his life. And it could be something simple or it could be something, dramatic on him. It's all in how you tell him the story and how you sit down and you tell him, and when he gets, he pretty much explained to me, okay, when he goes through potty training stage and he gets, constipated and he has tummy problems and, he has issues, there's always, you can always rely on medication to help, suppositories, things like that, and that's something that, wow, I didn't think of, I thought, oh, bam, surgery, bam, it goes away, and yeah, but you know what? It doesn't make me love him any less, makes me love him even more, like it makes me really be on top of it. I'm a stay-at-home mom due to the fact that I don't want to put his health and his condition in another person's hand that is not educated. I don't want to put him in a daycare and something happens and they're not familiar, with what he has, or when we go to a pediatrician and I have to explain to a new pediatrician about it, it's something that I believe that everybody should be educated on, and everybody should, I believe that everyone a couple years should take classes on like medical conditions and health conditions, because you never know. You could see a baby in the public, struggling, and a mom not knowing, you help, you know.
It'd be great.
So
It'd be great if we all knew about everything. That would be
right,
wonderful.
right, right,
It would definitely. But no, I think you're absolutely right there with what you say. Absolutely right. I think it is a tricky one. It is a tricky
right,
one to navigate. And
right,
again, when it comes to Hirschsprungs and when doctors talk about all sorts of things with you, they can often not necessarily talk in definites just because they can't,
right,
because it is so much of a varied condition. So I guess it is a
right.
little bit of trial and error and kind of see how you
Yeah,
go.
right.
Have you found that as well?
Um, he is eating solids as of now. I did do my research about what foods to give him and what foods will not be good for him. So we've been kind of going on a list of what's good with his Hirschsprung's disease. And he's been doing amazing. He's been taking the food really good. Sometimes his stomach will hurt, he'll cramp, I can tell in his face. And we'll do just exercises, and if I have any major questions, I will send an email out to his surgeon, and his surgeon will kind of walk me through of what to do, or like how to relax and calm down and see if it's this or if it's this. They communicate very well with you.
That's really good to hear. Really,
Yes,
really good to hear.
yes,
And just as we, I guess, come towards the end of this, I know I've asked a little bit about how Oakley is now and how he's getting
yes,
on, and really, really good to hear that
yes.
he is doing so well. So I guess I'll go a little bit further forward than that, and ask a little bit more. I know Hirschsprung's in future is a little bit of a difficult subject because sometimes we don't really know, what's around the corner. But what do you hope for Oakley's future?
Oh, there's so many things I hope and wish for him, and um, I just hope that he continues to do amazing, with his condition. And I hope that when he gets older, I'm able to sit him down and be able to talk with him and explain to him, that this was not your fault. It's just things can happen very unexpectedly,
Yeah,
you know,
absolutely.
and I hope, I hope he lives long.
Yeah. Yeah, well, you could
Yes.
play him play him back this podcast when he's
Yes.
old enough
I
to
always
listen.
I told my mom, she came down here a few weeks ago to see him because it's I don't want to risk traveling. A lot of my family lives states away, so due to his health condition, I don't really like traveling if I don't
Yeah.
have to. Just because his surgeon is here, and just in case I have to rush into the hospital, I'm right at home. And, I told my mom, I'm like, I can't wait till he gets married and he gets, meets a lady, and I get to sit down with her and explain all the things I did to him, when he was a little baby to help him with, this health condition. And, I can't wait.
Oh, that's so, so good to hear. But no, thank you so much for coming on.
Yes,
And I know it goes without saying, but I'll say it anyway, that I wish both you, your wife, and Oakley all the
thank you.
very, very best
Yes,
for
thank
whatever's to
you.
come in the future.
Yes, I really appreciate it. And I hope a couple years from now we can be right back here doing it again.
Absolutely. Would love to have you
Yes,
to return. Absolutely.
yes,
Thank you so much for coming on.
yes. Thank you so much.